There is much concern among some experts in South Africa that government's pace of vaccine rollout will not delay the third wave of COVID-19 infections. Some experts say the country will need up to as many as 250,000 vaccines every single day over the next 3 or 4 months to meet the inoculation target. Professor Tulio de Oliveira from the KwaZulu-Natal Research and Innovation Sequencing Platform, or KRISP, joins us now to have a discussion about this. So nice to see you again, Prof. Welcome to the show.
Good morning, and good morning to all your viewers.
Yeah. So there is a lot of anxiety among South Africans about the very slow pace of the vaccination process here in South Africa. Let's get your views on all of this. I mean, is it dangerously slow, or is this what we have been expected?
Yeah, most of your viewers and you're going to be aware that unfortunately that was not what we expected. We expecting in South Africa to initially to roll the vaccines that was purchased by the COVAX, and that means the million vaccine that had arrived from the Oxford Astrazeneca. Yeah. Unfortunately, we didn't have data on that vaccine on severe case and hospitalization, and we did not know how effective was that in our variant. And that's why they decided then to roll out a vaccine, the Johnson & Johnson, that is very effective against our variant. Yeah. And that did slow down a little bit the pace of vaccination. Yeah. I have visited many of the vaccination facilities in Durban because we work very close with some of the hospitals. It is very exciting to see a lot of the healthcare workers being vaccinated, but as many experts have highlighted, we also need to start moving to vaccinate the general population, especially the ones with advanced age and comorbidities. If we were to not have like a large number of deaths in a potential third wave.
Yeah, and that's the reality. I mean, when we're seeing approximately 10,000 vaccines being given a day over the last 2 days, we haven't seen many. I think it may have been on pause. It'll probably pick up again now. But there were a further 60,000 Johnson & Johnson vaccines that arrived over the weekend. It's lovely, but it's not enough. I mean, these are, when we keep on emphasizing that. And the question is, let me ask you this, is this South Africa's vaccine rollout, or are we still just working with Johnson & Johnson on their trial, the Sisonke trial? It's not obviously, there are no placebos being given. This is the real vaccine, but, you know, this isn't the mass rollout that we've been promised. We haven't even started that, have we?
Yeah, well, I personally expect is in the next few weeks the massive rollout will start, especially when one start also receiving other vaccines such as the Pfizer. Yeah, as you are aware, South Africa had engaged with Pfizer to get up to 20 million vaccines. Yeah, one thing that it is slowing down not only the vaccination in South Africa but many different countries in the world is that some of the developed countries they are cannibalizing the vaccines. Yeah. So for example, this big race by the UK and the US and Israel and United Emirates, to vaccinate close to 100% of the population. This week, the UK passed 50% of the adult population, and that's leaving very small number of vaccines on the market. Yeah. And what we think is that we as South Africa and both our government but also our private institutions, we may have to be a little bit more aggressive on trying to make sure that we receive a large amount of vaccine dose. Otherwise, these countries, the developed country, will vaccinate the majority of the population before making vaccine available. You may not be aware, but one of the rules that, for example, the US has done is that they would not export vaccines unless they have vaccinated the population. And that's one of the reasons as the Johnson & Johnson has been rolled out in South Africa as a very big implementation trial, as we also wait for the approval of our SAPRA. So it's a very dynamic environment, And I really hope we can start moving to the max vaccination the next few weeks, to not only to healthcare workers but also to the general population.
Yeah, certainly, and that's something that we need to see, and I'm glad you're emphasizing particularly those over the age of 60, because that would really assist in this. I mean, I'm reading Bloomberg have the most incredible graphic, and it's a COVID-19 tracker. I saw it this morning, and it was very much so a rude awakening as to where Africa fits into the equation. And you say that it is hoarding and the race for the vaccine. So just in numbers, and this was updated this morning, it says 447 million doses have been administered through 133 countries, 11 million doses a day. That was the most that's ever been recorded being administered. However, the US is really way ahead in this entire process. They're saying so far 124 million doses have been given. In the last week, an average of 2.4 million doses were given per day. Now, you look at the map and you see in dark green those that are far ahead on the process. So it's dark green, light green, very light green, and then white. And the majority of the African continent is still very much so in white. And that just shows you, I mean, this is inequality on the larger scale, isn't it?
Yes, it is. It's a big inequality on a large scale. And as you are aware, we have been very vocal, both myself, Professor Salim Abdul-Karim, and even our president, about trying to bring equality to the distribution of the vaccine in the world, because our main argument is that anyone is only safe when everyone is safe. If you leave countries behind and you cannot get vaccinated, you have the process of generation of the virus adding mutations, and creating more variants that may escape the vaccines. So it's become a big global effort to try to also roll that in other countries that don't have access. The WHO is trying with the COVAX, but I think in general, we probably have to be more aggressive as a global response to try to make sure that vaccines are available to everyone in the world.
Yeah. You know, we talk about COVAX, but one of the other issues is that the COVAX facility is a lot being used by Astrazeneca. I'd like to get your views on Astrazeneca, because obviously there have been a lot of alarm bells ringing around the world in terms of some countries stopping, Europe even expressing that they may want to halt it even further, African countries delaying it, then maybe using it again. Then there's the news that came out yesterday that South Africa have managed to sell the entire lot of Astrazeneca vaccines into the AU that we had purchased. So talk to me about your views on AstraZeneca.
Okay, so we did part on the research on the trial that happened in South Africa of the AstraZeneca. So just to bring some of the facts, in South Africa was a small trial, was a trial where 1B2A was only 2,500 individuals in each arm, and the average age of the people on the vaccine was 30 years old. So did not have like old people that generated severe disease. And that's one of the reasons why we don't know if the effect of the AstraZeneca on severe disease and hospitalization. Unfortunately, also the trial when they ran in Europe, the initial trial also did not have old people, and that's why countries like Germany and France, they didn't accept rollouts for people over 65 years old. However, new data has been emerging, and what we expect is that also the AstraZeneca may still be effective against the variants, but again, we need to see that data. And we believe that they are also working on a booster that would make more effective against variants that were found in South Africa or were found in Brazil. So again, it is a very dynamic space, and we should have more data in the next few weeks. But we're also going to have data in another vaccine trial that roll out in South Africa called the Novavax, and that seemed quite promising data. And what we have to do as scientists, is to increase the arsenal of vaccines that proven to be effective to the variants, just to give more breadth for our government and also the African Union and the Africa CDC to roll out more effective vaccines in Africa, because we want to make sure that the vaccines roll in Africa is also very effective. Otherwise, we may end up with dual problem. One, nationalism, the developed country not only cannibalizing the vaccines, but cannibalizing the most effective vaccines.
Prof, let's bring it back to reality in terms of what we're in right now. Obviously, the weather is changing in South Africa. The vaccine rollout is very slow. The religious holidays are fast approaching. People are wanting to go away for perhaps an Easter break. And we've almost seen this episode play out at the end of last year when the second wave came. What are the expectations on a third wave in South Africa?
Yeah, so the honest reason is that we do not know. Yeah, but one thing that we know is that if nothing changes, history tends to repeat itself. Yeah. So as you highlight, we are coming to a very similar process as end of last year, November, December, that everyone want to go on holidays, see the people that they have missed, yeah, and engage in kind of fun activities. And we also know that helped to spread the virus. But one thing that we also learned in the next few weeks is that the variant, when infected individuals, they do a high level antibody response, which potentially could protect for a third wave from a few months. So the reality is that we do not know if the third wave is coming now. We do not know if it will come in a few months. And that's why it's so important to do what the CSIR is doing, or we do at KRISP, to follow the data in real time. So almost doing analysis daily to see an increase in infection. So for example, this week we received a lot of samples, both us and the Stellenbosch University, of some very large outbreaks in the Northern Cape. And we are quick sequencing the virus just to make sure that it's not a new variant, which we don't believe that it is. Preliminary results show the same variant entering again in what we call clustered outbreaks. And that's when started a lot in young people. We also saw this week outbreak in prisons. We are starting to see some small outbreaks in hospitals. And that normally is not a very good sign, because that's how it starts before move to the population. Yeah. So the main take home to the population is maybe to hold a little bit on the celebrations. Yeah.
Yeah, and that is good advice. Certainly, just try and prevent yourself from getting it in whichever way possible. I mean, I've even heard here, and I imagine it's also a national thing, where a lot of schools are also starting to see infections and actually closing grades, and in some instances, schools closing for a little bit to try and mitigate the fear of the spread. So it's very, very much so with us, and we can't, unfortunately, escape it this time. I want to talk, before we start wrapping up, a little bit about the private sector getting involved in all of this, the private sector securing vaccines. Obviously, we know manufacturers would rather be supplying on large quantities, i.e. working with government organizations so they can send millions, hundreds of millions, if not. But the private sector, do you think this could actually help South Africa speed up the vaccine process to reach herd immunity faster?
Yes, absolutely. I think that one thing that we are learning a lot in South Africa is that we need a public-private partnership. Yeah. So, for example, we know some of the plans when the large number of vaccines enter the country is to use a lot of the private pharmacies. Yeah, most of pharmacies in South Africa, they are very commonly used about giving injections, for example, vitamin D injections. Yeah. So to use that kind of facility to speed up the delivery of the vaccine, because the idea it is, as the number grows, to make that not only a medical facility. So, for example, now we are only rolling out vaccines in hospitals, yeah, and in a very medical process. And what we have to do is to try to to think a little bit out of the box, such as using vaccines or what is happening at pharmacies or what's happening in other countries in the world, even drive through for vaccination, to try to increase the number of people and the speed of delivery of the vaccine. But again, we first have to make sure that the vaccines arrive in the country and then have an implementation plan, which I believe that's been working at the moment, and I really hope to see that happening quite quicker, sooner than later.
Indeed. And then just finally, as we wrap up, in terms of the amount of vaccines that we should be giving per day so that we can reach herd immunity. I mean, the government has set targets. We heard the Deputy President saying that we could be vaccinating approximately 1 million South Africans by the end of April, and then reaching herd immunity by the end of the year. These promises, are they doable? Or at this rate that we're going, for me, it personally does not look it, but you are much more in the know. Do you think we can reach these goals?
So again, it will depend of a number of facts. One, it is to have enough vaccine, because I think that South Africa would have good distribution channels. One, show the world, we went from a country that was denying HIV to have the biggest and one of the most successful antiretroviral treatment program in the world. So I honestly think that when South Africa and South African people want to do things, they can get things done. But we will need to really start to speed up, getting the vaccines, and then make sure that we engage both the public and the private institutions together with public support, to try to scale that very quick. So it's going to be a very big moving target in the next few days and next few weeks, and let's hope we come to the right direction, because as you say, in the current speed of vaccination, it is very slow, because mostly focused on healthcare workers and only one vaccine, which limited numbers.
Indeed. All right, Prof, thanks so much for talking to us here on the program. It's always really a pleasure speaking to you. Professor Tulio de Oliveira from KRISP, talking to us about South Africa's COVID-19 vaccination process. I mean, reports coming out, I'm reading here in the Sunday Times, basically saying that we need about 250,000 vaccines to be administered every single day for the next 3 to 4 months to even think about reaching herd immunity. We'll see you after this.